control.
Okay, so my name is Vanessa and my topic is post-traumatic stress disorders and substance use disorders on veterans' readjustment to civilian life. It's kind of lengthy, I know. So my topic introduction is this study focuses on veterans' struggle with PTSD and SUD and how it affects their readjustment back to civilian life. So what do I know about veterans? Based off like the DSM-5 criteria, veterans' symptoms often include reoccurring memories, haunting dreams, dissociative reactions, flashbacks, and negative changes in moods. Right. So in the long term, it's really difficult for them to come back and, socialize with everybody. Right. So my research question is how effective is virtual reality exposure therapy and cognitive behavioral therapy in helping veterans abstain from substances, and how positive of an impact it may have on veterans. Past research, several studies tested unemployment and mental health among veterans. For example, a specific research program known as the Maintaining Independence and Sobriety Through Systems Integration Outreach and Networking, also known as MISSION. That's basically a previous research that the Veterans Affairs granted unemployed veterans housing and psychological rehabilitation for mental issues such as depression. In this particular study, their objective was to study patterns of employment homeless veterans by comparing their mental health and substance abuse to the general population. The United States of the Department of Veterans Affairs set up a rehabilitation program in order to serve veterans with a better chance of employment upon the completion of the MISSION program. The studies that were addressed were unfortunately not successful because the veterans were not compliant to finish any of these programs. So although there have been studies of unemployment in the US, there needs to be more studies examining PTSD comorbid with substance abuse. My method section, I decided to do it on, my participants were 20 veterans that have predetermined criteria of PTSD and SUD, and their age range was 20 to 35. I forgot to include male, but it is males only. Participants will be recruited from the local population of veterans seeking treatment from the clinics in Harlingen and McAllen hospitals through internet advertisements, flyers posted at the local mental health clinics and colleges. My incentive for the participants would be a $15 gift card from their favorite restaurant. The measures that participants need is the predetermined criteria on PTSD and SUD to undergo therapy. For example, some of the sample questions that I used for cognitive behavioral therapy sessions are: how is your mood? How is your physical health compared with last week, and is it better or worse? Were you uncomfortable about anything we talked about in our last session? Is there anything you wish we had discussed that we didn't? What treatment goals would you like to work on today, and what problems would you like to put on the agenda? And the last question, what homework did you attempt or complete for the last session, and what did you learn from doing it? So by homework, I mean they keep a daily journal log on what triggers negative emotions, and they write it down. So when they get to the therapist, they explain to them how they felt and why they felt that way. So the therapist can then pinpoint where their maladaptive thoughts come into play and tell them how to fix it, or how to correct their maladaptive ways of thinking. My method design was a quasi-experimental group design. My independent variables, I had two, which is, I didn't get to explain the virtual reality therapy, but Reshma definitely explain that to you guys. And cognitive behavioral therapy. My dependent variable was a positive, whether it has a positive impact and its effectiveness, and the abstinence from substance abuse and score on a substance abuse scale level. My second dependent variable is whether or not PTSD was improved. So, my anticipated limitations and future research directions. Some of the main limitations of this study would be the sample size, the substance abuse from any drug. Like, I focused on any drug, not just one, which I probably should have just focused on one, like alcohol. And it would be in my best interest to focus specifically on the recruitment of like testing both males and females. For future research, we should look into different gender groups to see how PTSD and SUD affect their readjustment to civilian life. And that's the end of my presentation.
8 minutes. Does anybody have one question? Okay. Well, send me your PowerPoint, please.
I will.
Or unless you have a copy on that.
I will send it to you.
Okay. Sarai, can you stick around after class?